People who inject drugs are experiencing an increase in severe wounds because of a lack of access to clean injecting supplies and a worsening adulteration of the unregulated drug supply. Healthcare providers often have little experience speaking with patients about their substance use. Knowledge of and comfort with discussing harm reduction practices are a critical part of supporting patients towards improved health. Here, we will see a physician discussing an approach to safer injection.
Hi, Rosa. Good to see you again. Thanks for coming in. Now, I know this is your regular check-in, but it looks like you recently went to the emergency room for a wound, and you followed up with the staff here. Is that correct?
Yep. I mean, I've had this for a while, but that day it was really uncomfortable, and it got worse, so I just figured it was time.
It looks like they did a pretty good job. Did they start you out on any antibiotics?
Yeah. No, I'm almost done taking them.
Good, good. So I know you're working on cutting down, and you're taking your subs. And I also know for most people it's a process. Some days they take their subs, sometimes they don't.
Yeah.
Yeah. So I just want to make sure you have everything you need to keep you safe while you're injecting.
Yeah, and I never share my needles, ever.
Well, awesome. That's great. It's also a really important way to keep you safe from infections like HIV and hepatitis C.
Yeah, and I get tested every 3 months, and I'm always fine.
Good, good. I also want to make sure you know that you can also get HIV and hep C from sharing cookers and water and...
Wait, what?
Yes, we need to do a better job of letting people know about that. Unfortunately, HIV and hep C rates are rising in the city among people that are injecting drugs. So there's another thing about safer injecting that I want to make sure that you know about. Are you okay on time?
Yeah. I mean, I got nowhere to be. It's my ride's not picking me up till later.
Okay. So even if you don't share equipment, unfortunately, you can still get an infection from your own skin, like in your skin, bones, your heart, especially if the needle is dull.
Well, I'm clean, and I shower every day.
Oh, absolutely. It's not at all to imply that you're not clean. It's just that bacteria is on everybody's skin, always. And it doesn't cause a problem unless it gets deeper in the skin, muscle, or in the bloodstream.
Oh, yeah. Yeah, that happened to my friend. They said she had MRSA. Look, I don't want to get that.
So we have a handout on safer injecting. It has a lot of helpful information. Rosa, is it okay if our certified peer specialist, Tom, checks in with you about any questions you may have and make sure that you have access to clean supplies?
Sure.
Great. Well, good. I want you to make sure that you read through that.
Here, the physician uses a few techniques of note. First, their treatment approach includes both acute care and ongoing risk reduction. They distinguish between personal hygiene and injection sterilization, which builds trust with the patient. Harm reduction is sometimes called compassionate pragmatism. It means meeting people where they are and helping them get where they want to be. You may not feel comfortable covering all aspects of harm reduction in a patient visit. Start with something simple, like prescribing naloxone, encouraging people not to use alone, and supporting access to clean drug use supplies in your community. Treatment for opioid use disorder is a long journey for the patient and the physician. The first step is helping people stay alive.